Good morning, folks. Happy January 18th to each and every one of you. We can all marvel that we're over halfway through this first month of 2022. The superintendent has asked me to facilitate this session today as she has the land board meeting, which is continuing at this same time today. So I thought I would start with the OPI vision of putting Montana students first and share with you a Maasai tribe out of Kenya's greeting to adults. Question, how are the children? The response, all the children are well. And I hope that in 2022, we'll be able to respond in like manner about our children and the purpose of this work that we're all engaged in. We're going to get started with CSCT. We have a Resigned Memorandum of Understanding that I'm going to have Brian put on the screen for you so I can point out to you two of the changes that were made. They were very minor and want to point those out. DPHHS and the OPI have both signed off on this CSCT that will get out the door today to our districts that provide CSCT. So Brian, if you can share that screen, that would be lovely. Until we get that up for you, let me point out the two key points. I know we have a full agenda. The first request was to change the effective date of the MOU from October 1, which was set in conjunction with DPHHS, because when the state plan amendment was going to be approved, that's the date it would retroactive to, also the date in which the change in per diems. There it is. Brian, if you'll scroll down a little bit for us, please. Keep scrolling. The term of the agreement right there, that's a good stop. So you can see the term went from October 1 to January 1, 2022. And if you'll head down, the other change that was made in this was indemnification, in which we went into double indemnification. So it's almost near the end of the MOU, Brian. Well, here we go. So in here, you can see the third and fourth paragraphs. One, that districts are held harmless by DPHHS, and OPI agrees to indemnify and hold districts harmless in the following paragraph. So those folks are the changes that occurred to the IGT MOU. So wanted to share those with you at this time. And as always, if you have questions, I'm always available on this. You're welcome to pop questions into the chat or give me a call and say, hey, let's talk. Any of those work. So we have with us this morning as well, Dr. Lauren Wilson and Dr. Lori Carter from the Montana chapter of the American Academy of Pediatricians. We're happy to have them here with us, and they've got a couple updates for us. One related to the Omicron variant, and then the vaccination rate of children. So ladies, Lauren and Lori, over to you. Thank you for being with us today.
Hi, thanks for having me. Can you guys hear me okay? Great. Dr. Carter was on call overnight with the Peds ICU, so it's just me today, but I have a brief update for you, and I can share my screen as soon as the other sharing stops. So thank you. All right. In 1 second. All right. So my name is Lauren Wilson. I'm a pediatrician and a pediatric hospitalist, and I'm just here to give you a brief update on where we are with COVID, particularly with respect to child health. So it's kind of good news, bad news. We're in the midst of a rising number of infections due to the Omicron variant. Good news is we have a lot of tools in our toolbox that can prevent infection, and that on the horizon, but not really here yet in any meaningful way, we have maybe some improvements to therapeutics that we can use to treat it. So a lot of you are familiar with the COVID dashboard for Montana. I was trying to screen capture today's really quickly because we had over 3,000 cases reported out this morning. But specifically just looking at kind of our story of COVID over time in Montana, we had last winter, we had kind of the alpha wave. As school was starting, we had the Delta wave, and now close on the heels of that, we have a rising number, kind of a steep rise showing the Omicron variant's arrival in Montana. If we look at the US, we see that the case numbers with the Omicron wave are actually hugely higher than they were for the previous two waves overall. And a lot of these states just saw Omicron before Montana did. So there's no real reason to think it won't behave that way here. Just a little bit about Omicron. A lot of you guys probably know this, but it's more transmissible. We think about twice as transmissible as the Delta variant, which was in turn much more transmissible than the Alpha variants. Vaccination is less protective against people getting sick or getting infected with the Omicron variant. It still does offer protection. But the really important key point is it continues to be very protective against hospitalization and severe disease. We're seeing some data out of New York where they had Omicron a bit sooner than we did, and they said that their unvaccinated people are about 13 times more likely to be hospitalized. And some data to the right there, what you're seeing is from Switzerland, and it shows that the booster dose, which is at the bottom, really confers a lot of additional protection against mortality from COVID as compared to people who are fully vaccinated, meaning just 2 doses, and people who are unvaccinated. So the rate there is really markedly different. And the good news is, you hear a lot about this being milder. The hospitalization risk appears to be lower for an individual. If you get an infection, your risk of being hospitalized is lower. But the case numbers right now are so high that nationwide we're setting records in the number of hospitalizations that we're seeing. This is kind of national data. And that last little peak is showing the number of people in the hospital. And I know in Montana, we were really strained, our health systems were really strained with the Delta variant. So, if we follow this pattern here, that's going to be significantly difficult for us, particularly in the face of kind of worse staffing than we had earlier in the pandemic. So just to review, I presented to a group before about COVID in children early in the pandemic, and a lot has not changed. We know that most often when a child gets COVID, they have mild symptoms or they can have no symptoms at all. But there are some serious consequences of COVID that can happen in kids. And because of a lot of spread and a lot of cases that we've had, we see that over 1,100 children have died of COVID since the start of the pandemic, which puts it in one of the top 10 causes of death in children overall in the past year. The serious complications that I see in my practice are usually people hospitalized with pneumonia, with fever, with dehydration. That's more typical with infants. We're seeing people with heart inflammation as a result of COVID. We do see some blood clots, which can travel and cause heart attacks and strokes, even in children. One of the things that we saw on the tail of the Delta wave was a big increase in the multi-system inflammatory syndrome in children, which presents with fever about 2 to 4 weeks after the initial COVID illness. And then people tend to have a lot of different symptoms because it affects different organ systems. And this nationwide has been seen to be a pretty severe illness. The majority do require care in a pediatric ICU. And that's been our experience as well here. Long COVID, luckily, is less common in children than in adults, but the best point estimate I've seen is about 8% of children continue to have symptoms 2 to 3 months out, and that can include neurocognitive symptoms, which would really affect their functioning both at school and at home. And just because of sheer numbers of cases, we're seeing that actually the most recent reporting is there are record numbers of children in the hospital with COVID right now as compared to in previous waves. Our vaccination rates in Montana, you can see kind of an overview here from DPHHS. Our 5 to 11s, we have 13% who are fully vaccinated. That's lower than the national average, which I believe is around 16% right now. But that's really variable. There are states where the majority of children in that age group are vaccinated and about 8 million doses have been given. We also see that our 12 to 17s are 38% fully vaccinated as opposed to 54% nationwide. So we're lagging there as well. Vaccination in children, I know this has been a hot topic and there's just a lot of information and a lot out there on this. So when the FDA approved the vaccine, they ran a number of scenarios looking at the effects of COVID on children, the effects of the vaccine, and there are known risks to any vaccine, but in every scenario where there was ongoing spread of COVID, vaccination was clearly beneficial for the health of individual children. So it protects them against becoming sick, and really, an ongoing monitoring has really greatly reduced the risk of hospitalization more than even I expected. We're seeing that it reduces the risk of MIS-C, which was an open question before, so that's good news. It reduces the risk of myocarditis. You hear a lot about myocarditis as a side effect of the vaccine, and it is in fact a rare side effect of the vaccine, but it is also something that can happen with COVID. So overall, your risk of myocarditis is lower if you're vaccinated. It may also, we have some preliminary information showing that the vaccine may reduce the risk of long COVID. So I really am looking forward to seeing a bit more on that, but there's a preprint study out now on that. So that's great. And it should be said that vaccinating children is also beneficial to kind of family and community transmission. And I think one of the greatest impacts on kids that we're seeing is the number of kids in Montana who have lost a caregiver due to COVID. Nationwide, we estimate about 170,000 children have lost a caregiver, and a lot of our pediatric and psychiatric providers are seeing effects of that. The Montana Medical Association and a number of different groups have come together to get information out there on vaccination specifically for kids. And so there's a website up now if you have time to visit it. It's yourbestshotmt.com, and it provides some basic information for families and for providers and encourages you to reach out if you have questions. Prevention, not a lot has really changed in the prevention arena since I updated some of the school officials last time. We think of protection as happening in layers, and that's really the most effective way to go about it. Vaccination is an important layer. Face masks also, particularly in the setting of Omicron, we're seeing that higher quality face masks, because it's so effective, tend to make a difference. N95s are usually not available for kids, but KN95s, KN94s are available in child sizes, probably more effective than surgical masks, which are in turn more effective than cloth masks. Ventilation has probably been a big focus of people in this group. So, moving events outdoors, even opening windows periodically, upgrading systems has been really effective and helpful at reducing spread and encouraging people to stay home when sick. We also continue to recommend hand washing in times of increased transmission. Other tools like cohorting, surveillance testing are important, testing people with symptoms, contact tracing, and distancing as much as one's able. Less helpful, and we thought early in the pandemic these were key, but they're probably less important, are doing aggressive surface cleaning and using those plastic dividers, which can actually interfere with airflow and might not be helpful at all. Face masks, just the data as a refresh. When we looked at the Delta wave, schools who had mask requirements had about 3 times fewer cases than schools who just had recommendations. And that was reflected also in some data collected locally in Gallatin County, which really agreed with the magnitude of the impact seen by CDC when they looked at it. When people wear masks locally, so like a county mask requirement also reduces school cases. So school cases are approximately double when there's no local requirement. And that just reflects that our schools are kind of microcosms of community transmission. Isolation and quarantine, I think, has been really important to schools. And there have been some changes that I think have not been communicated super well recently, but just to review, isolation is if you're tested or you're presumed to be COVID positive yourself, and quarantine is if you're asymptomatic, but you're a close contact of someone who's a COVID case. Isolation was recently shortened to 5 days as long as symptoms are improved and fever is gone, followed by 5 days of strict mask wearing. So that's a new change. Quarantine, if there are no symptoms, if you are fully vaccinated and if you're eligible for a booster, you're boosted, you don't need to quarantine for CDC, but should wear a mask for a 10-day period. If you're not fully vaccinated or boosted, then you should quarantine for 5 days, test, and continue to mask for 5 additional days. And they made some rules about student contacts, which are a little bit different, but are based on some data out of Ohio and other places showing that if both students are properly masked and one is COVID positive, the rate of transmission is relatively low, so quarantine is not required in that circumstance. We've made some guides. Some of our members, this is Dr. Carter's work actually, have made some guidance for school districts on what the CDC guidelines say, so they can look at those, and I'm happy to share those if people have questions about them. And to finish up, just a word on therapeutics. You probably see a lot in the papers about, evolution here, so I just wanted to speak to that. We were using a lot of monoclonal antibodies during Delta with some changes in Omicron. The only monoclonal that's really likely to be effective is sotrovimab. So that's the one that we're using now. And we have less availability than we used to have with the variety of monoclonals that were available before. There are new oral medications. Paxlovid is the one you probably heard the most about, that are on the horizon and are in fact being received in small quantities. But the supply is so far, we've just got a handful of courses of this for each kind of Montana city and pharmacy that's receiving it. And so it's really restrictive, and it's really being given only to people who are super high risk. And all of these therapies, like, you can only get them if you are diagnosed with COVID. So that requires early diagnosis. These oral medications are supposed to be started within 5 days of symptoms if you're going to use them. And for some, that's a barrier in, seeking out a test, getting a test and getting a result, and then accessing the medication in time to use it. So I'm really excited about this, but I think it's on the horizon, and it's probably unlikely to help us very much in the next few weeks. Kind of ending on a down note, but if anyone has questions, I'm happy to answer them.
So what questions might you have for Lauren from that very informative presentation she provided to us? Lauren,
Yeah,
it looks like we're good. Thank you so much for that. Much appreciated.
Absolutely. If anyone wants to reach out to me, I think my email is somewhere or can be shared. So thank you.
Absolutely. We'll make certain that's included. So let's continue to learn about the availabilities for testing and trends. So we have Todd Harwell with us from DPHHS. Todd, thanks for joining us this morning.
Good morning, everybody. And Cheryl, thanks for the invitation to speak with you guys today. Excuse me for a second. Phone's going off. I was going to hit a couple things, and I'll hit testing last, but a couple updates, and some of them dovetail really well with what Dr. Wilson said. So just a few updates from DPHHS. So I think if you saw Dr. Wilson's slides, we just surpassed 200,000 cases in Montana just over the new year. We have approximately about 10,500 persons who are hospitalized with COVID since the beginning of the pandemic. And unfortunately, we have we'll probably exceed 3,000 deaths from COVID here in the next couple of weeks. In terms of kids less than 18, we've had just under 29,000 cases of COVID reported among pediatric age kids, 128 hospitalizations, fortunately no deaths, which is good. And as Dr. Wilson mentioned, we have had 19 cases of multi-system inflammatory syndrome in children reported in the state. We had a little spike of those cases in the fall from the Delta surge, and all those children were hospitalized. And in this current surge we're seeing right now with Omicron, we are seeing an increase in the number of pediatric cases reported. The other thing I just wanted, I'm sure you're aware of it, but I just wanted to touch on it briefly, is beyond just COVID, we're also seeing an increase in other respiratory diseases right now, in cases and hospitalizations, both influenza and then other respiratory viruses like RSV. So just a reminder for everybody, it's also important to get your flu vaccination for everybody who's 6 months and older to help prevent influenza, and also same concept with COVID, prevent hospitalizations and deaths for people who are vaccinated. And as Dr. Wilson mentioned too, there's lots of things we already know of and we can do to prevent and mitigate the spread of COVID, from everything from vaccinations to masks, testing, and other things. So I'm not going to repeat that. Let's see. In terms of testing, just a quick update. I think you guys are all aware there's major challenges across the United States in terms of supply chain for the rapid tests. So like the Binex Now and the other rapid tests. We're experiencing that we had been getting our supply over the past year and a half through Abbott Pharmaceuticals, both with the CLIA-waived test, the Binax Now, as well as the over-the-counter home test. We have a large pending order with Abbott that goes back to October, and hopefully we'll get that order filled. That's for 220,000, both CLIA-waived and over-the-counter tests. And you probably heard from the announcement from the governor. We've also just recently procured additional 650,000 over-the-counter other vendor. Those tests should be here next week. And we have 2 distribution plans. I just want to make sure you guys are aware. It's tentative until we get the approval from the governor's office, but I think this is the direction we're going to go. We have about 25 requests from our current pipeline for Abbott for about 25,000 tests for long-term care, healthcare facilities, K through 12 schools, and the university system and other partners. We'll fill those orders next week so they can get those over-the-counter tests and have them accessible. And then a large portion of the remainder of the tests are going to be distributed to local and tribal health departments across the state, who will distribute them to the public through different community sites. So that's the plan right now. It may change through this rest of this week, but we'll get more information out so everybody's aware. Just a few other things I want to share with you about testing resources you may or may not be aware. So all of our federally qualified community health centers and our rural health centers across the state currently can order a large quantity of rapid tests, over-the-counter rapid tests, through the Health Resource Service Administration. And they're doing that right now and getting their supply. And those tests are not just meant for the CHC patient population. They can be distributed to partners in the community, including schools, public health, or other partners. So I would recommend touch base with your community health centers and RHCs if you have them in your communities, or share that with your membership to know that that might be a place where they can get access to rapid kits for schools. And then two other things for testing. Tomorrow, I believe, the federal government will open up the website where households across the United States can order test kits from the feds and receive them through direct mail. So the website is covidtests.gov, and that opens tomorrow. And from what I understand, there's about probably a 7 to 12 day lag time for the mail through the postal service, but all of us, everybody here too, can order up to 4 tests from the federal government through that. And also, just so everybody's aware, for testing, we do have the issues with supply chain issues for rapid tests, but we still have our system in place for PCR testing at our state public health lab and our 4 reference labs that we've been using over the past year and a half. That system's still in place. We're still doing testing. The number of requests for testing obviously is going up with the surge, but that part of our system is functioning well. And then 2 other things I just wanted to share with you guys. I think you guys are all aware. Last fall, we got funding from CDC for the school reopening grant. And that went really well. We had over 80 school districts apply for funding to support staffing and supplies to do testing and other prevention and mitigation activities within the school. So 82 school districts applied for that, and it went really well. We got really good feedback on how that helped keep schools open and help manage the issues for the day-to-day for schools. So that was good. We reopened a second wave of funding for that pot of money just the last 2 weeks. So those 82 schools are eligible to reapply for an additional amount of funding to help them go through the rest of the school year. And then any school districts or private schools that didn't apply in the first round can apply for this in the second round and receive funding to help support their efforts. So if you could share that with your partners, we'd appreciate it. BJ Biskupiak's been our lead, and he's pushed out information to the school districts, and many of you guys have helped us get information out. We totally appreciate that. And then last thing on schools for us is we also received a public health workforce grant last fall from CDC. A portion of that went to support workforce in the local and tribal health departments, but a sub portion of that was dedicated to school health. And so we put out a request for applications, and we got 14 applications from school districts across the state, both urban and rural. So everything from Great Falls and Kalispell to Webo. We were able to fund all 14 of those applications, and the funding for that is to be used for workforce for school health. So what people applied for was everything from school nurses for schools that had no nurses at all to mental health providers and other providers. So that money is going out the door to help the schools with that. And the last thing I just wanted to share with you guys is just a big thank you over the past 2 years to OPI, and then all of you. One is you guys have been terrific about helping us get the word out about these funding opportunities and just general communication with your school partners. We appreciate that. And then, I personally too, I think all the work you guys have done to help school administrators, teachers and staff and kids be safe in this time. So just thank you. That's all I had, Cheryl. I'd be glad to take any questions.
Thank you for that thorough update, Todd. Are there questions you have for Todd?
I'm a quiet group here.
We have a quiet group here today. Thank you, Todd. We appreciate
It's a Monday.
that.
No problem. You guys have a good day. And again, thank you. We appreciate it.
Thank you. We appreciate that. Let me really quickly, before we go on to Ian's and Esser updates, introduce an individual that I know many of our Montana entities have utilized in the past. We've got Katie Drummond on the line with us. She's the new director for the Northwest REL. Welcome, Katie. Would you like to say a couple words to this group? I know they're going to be interested in getting to know you.
Sure, and I can just be very brief, but I'm Katie Drummond and I'm representing the Regional Education Laboratory for the Northwest states. And my organization, Wested, is very excited to partner with Marzano Research to run the lab for the next 5 years. And as many or some of you may know, this is a change in the leadership of the lab that the Department of Education runs. And we're just really excited to get to know all the partners in Alaska, Oregon, Washington, Montana, Idaho. And we talked to a number of people as we were submitting our application and getting ideas for topics and projects that are a priority for you. And this is something that will continue over the next 5 years. So need sensing, as they call it in this lab, is something that's very important to us and to the federal government, and to kind of keep circling around to figure out the best way that we can use our research and evidence and data-based decision-making kind of skills for the lab for your purposes, and helping bring those resources to you all.
Thank you, Katie. We're happy to have you here with us. And I know we've got a number of folks that will look forward to building those relationships and working with you. Thank you so much for joining us today.
Great.
And Janie, we'll go over to Janie Solomon for Ian's updates. Those are our non-public funds to support education.
Cheryl, I thought Jeff was going to take this for me. I apologize. I'm going to leave my camera off. I'm having some internet issues and I tend to get dropped.
Okay.
So is Jeff on? He has my.
He is. So Jeff, we'll move that on to you to give us both.
Yes,
Ian's
I
and-
apologize and thank you, Jeff, for stepping in for me.
All right, thanks. I just need to be able to share my screen. All right, here we go. Okay. All right, so you should be viewing the monthly update for the EANS funding that my colleague Jamie Solomon administers. You'll see we are in EANS 1 funding now. And to date, as of the 14th, $865,000, $838 have been drawn down on that. A total estimate of about $6.5 million is estimated to go out to schools, or sorry, to private schools and homeschool students over the life of EANS 1s, with an estimated total of about just shy of $6.3 million will come back to the governor's office to be reallocated towards other educational relief efforts. And so, so that is where we stand with EANS 1. With EANS 2, we just completed the intent to apply, or we're in the process of doing the intent to apply right now. So we have 49 preliminary applications there. We have a total amount of about $11.8 million that we will that are available to allocate out. And so as that progresses, we'll have further updates on that in the month ahead. And Jamie, if there's anything you want to add, you're certainly welcome to.
Thank you, Jeff. If anybody has any questions, I am happy to take them for you.
Okay. All right. Well, we'll switch over to Esser, the Esser funding update. Not significant changes here based on from our last report. I will say that this, as we look at Esser 1, it is in green because we're actually dealing entirely with actual dollars spent. The columns that are in yellow, the percentages that we are utilizing below is actually based on budget versus actual expenditures. So, but in this top portion here, you'll recall that we had just over $40 million allocated to school districts in Esser 1. We are just about to $33 million expended. This number is a little bit old. I should have a new number for to update by the end of the week, but we're staying pretty consistent with spending down about $1 million a month. And if we continue to do that, that will get us to full utilization of Esser 1 by the end of the obligation period, which is the end of September. You'll remember that each of these funds, they do have to be obligated by the end of September in each of their respective grant term years, which you'll see at the bottom of this handout, 22, 23, and 24. But they do have to be liquidated by the 10th of November of each of those respective years. For Esser 2, we have now exceeded our spending in Esser $2 has exceeded our spending of Esser $1, which should be the case, as there were just over $160 million allocated out to school districts. To date, we have about $145 million of that is budgeted, and we are still seeing updates to budgets pretty routinely. And as I just mentioned, we have now spent over $38 million of Esser 2. Esser 3, really schools are doing more work on the budgeting front here. And there's less spending activity here right now as they work to fully spend Esser 1 and move into Esser 2. But total allocation there is just over 347 million. About to date, almost 304 4 million have been budgeted, and just under $11 million have been spent to date. So in terms of what schools have been using their funding on, that's remained pretty steady. You'll notice if you're keeping track at home, you'll notice a little bit of fluctuation in the percentage of usage, but still the number one priority for use of these funds has really been spent on staffing initiatives. That's both to recruit and retain staffing, as well as provide specialized services, whether that's counseling support, summer after school program support, as well as health and wellness staffing. So, and then the second largest that we're seeing, particularly in Esser 2 and Esser 3, still tends to be property and property services. We're seeing a lot of HVAC replacements, systems upgrades that are improving air quality, and then facility renovations that facilitate a healthier learning environment. So, we have seen kind of a steady decline on spending towards supplies. What we're seeing more now is kind of replacement technology spending and still PPE spending. So that's a good overview on the Esser front. I'll take any questions that you might have. All right.
Thank you, Jeff.
Thank
We
you.
appreciate those updates and keeping folks tracked on that trend line of what things are looking like in our school districts. We'll continue to move forward. We've got Crystal Andrews with us today to provide a brief update on the rule review on Chapter 57, which is our educator licensing rules. So Crystal, thanks for being with us this morning.
Good morning, Cheryl. Good morning, everyone. Yes, I do have an update on Chapter 57, and it was also requested that we share a little bit of information on where we are with our transition to our new licensure system. So I have Zam Aladina, our project manager, here with me today as well. So we will briefly go over both with you. I will be sharing my screen. Zam, give me 1 second. You can get us started.
Perfect. Thank you, Crystal. I'll just wait until your screen comes up and I can talk to the slides. So if we want to go to there, we can start there. So basically, there's been a lot of work that we've accomplished since we've actually started this initiative back in spring, early summertime 2021. And basically, we've gone through an RFP, selected a vendor, and at the end of December, we were going through our contract and statement of work negotiating, which was actually executed at the end of December. So where we're sitting at right now is we've actually have the vendor on ground able to put together a team and move forward with developing a project plan. And at this time, basically, January 1st is when we've operationalized our paper application. So external users of the MSIS system right now are still able to provide data and provide information. However, it is through paper applications, and our OPI specialist, as well as the OPI team, is processing that information. So what does that mean basically for us on the project side? We did have a pre-planning project activity kickoff last week. And what that included was our project team, core project team, as well as Randa, which is the vendor, which I'll talk about a little bit more later on, discussing basically our rules of engagement, what those activities are, and what it really, it takes for both of us, OPI and the vendor, to get to the finish line by June 1st. So we're in our project planning phase. However, there is consecutive work streams that are occurring at this point right now, which includes analysis of the current system, documentation, both on the business and the technical side. And as we're going through that right now, we're also developing and finalizing the formal project kickoff, which is going to occur this Thursday. And so once that occurs, which will involve all the stakeholders, our business and technical stakeholders, basically talking about how we're going to be doing this moving forward, what those expectations are, what the documentation, the methodology, really level setting our expectation in terms of our aggressive timeline and our schedule in terms of our activities with the business and our technical team to move forward. And once we do that, we're actually also in a planning phase of our project plan. So there was a project plan that was defined in December time during our statement of work. I'm working with the project manager from the Randa team to update that project plan. So for the next 4 to 6 weeks, being a lot more precise in terms of our business engagement, what that time and effort would take from now until the next 2 months, and being able to have that visibility for our business and for our technical teams so that we can work towards capturing those requirements, doing the configuration on the system, as well as doing, which is one of the more important parts of this implementation, is a data migration. And so obviously data being a big aspect of this entire core system, what does it take to take that data from what it is right now into the new system? So as that's occurring, as we're working towards that, we're also developing the plan and those activities as we move forward. So to date, we've provided the Randa team, the vendor, technical and business documentation, and we're also doing a copy of our current database and having that sent over to Randa for their analysis as we move forward. And we are still on target to meet our June 1, 2022 for a full implementation of the system. So if we can go to the next slide. So this slide basically talks about our timeline. And what I really wanted to show was, even though we've just engaged with the core vendor team, there has been a lot of work that's happened prior to that, including requirements with the business, the RFP, going through a selection process, and then obviously onboarding our vendor, through our contract negotiating, and also from the statement of work. So as you can see right now, we're sitting in early mid-January time period, and so during now until June 1st, we're going to be going through our analysis, design, and configuration and testing of our system. And I didn't want to leave testing behind, because that is obviously a big part of what we're going to be doing, and including training. And so for the next several months up until June, we're going to be heavily involved with the vendor who's going to be leading the effort, and then myself working with our business and our technical team on the OPI side, ensuring that we have what we need, identifying the risk as we move forward. So within for February and April, we're really looking at the platform configuration, what that looks like. We're looking to complete our data analysis and really starting our migration starting in April of this year. And then from April to May is our testing period and training period. And during this time, we're going to be heavily testing not only the data, the system, but also having the business and the end users really involved at this point right now. May 6th is an operative date that that we had, which was basically we are going to be shutting down and limiting access, restricting access to the system. And so what this means is we need to have a point in which we need to limit the data that's going into the system. And so between May 6th and June 1st really is when we're looking to do the full migration of the current system. And so what that means is basically the system will be up June 1st. And any information that hasn't been moved over May 6th will happen after June. And then June 2022 is when we're looking to do a post-launch cleanup. And then from a 12-month period from June 22 to 23 is when we're going to be in our maintenance and support. And so the activities that we have, I've listed on both sides. And these are what we're going to be managing our expectations in our kickoff in terms of, responsibilities. Randa is very versed in implementing these systems, obviously very specific in licensure. It's a very niche market that they're in. And so, I've listed exactly, what they're going to be doing at a high level. In terms of our contract right now, our full deployment system is June 1st, 2020. But then, like I said, the support and maintenance part of this application is going to be occurring June 2022 and up until June 23. And so during this time, any of the system upgrades, any of the issues related to the system is going to be handled and mitigated by Randa. So if we want to go on to the next slide. And so Randa at a high level, the reason why they were, clearly selected in this RFP is, they are a very niche, in a very niche market. Their clients include the state of Tennessee, state of Colorado, Kentucky, as well as South Carolina for licensure systems. So not only have they implemented licensure, they're also subject matter experts, so they understand the business, but also very heavily involved in the technology as well, which was basically a very advantageous approach that they had. And so, it was really an easy selection when we went through a very extensive phase during the RFP to select Randa. And just as a side note, I've worked with other systems before, other vendors. What I really liked about Randa was some of the issues that we brought up and some of the concerns that we brought up. Not only did they have the answers for, but they've actually specifically worked within those type of issues, those areas. So not only understanding the data inputs, the databases, the operations, and the processes. They come to the table really with an understanding of some of the major risk and how to mitigate those even before those are identified. And so, in terms of the impact of modernization, basically what we're looking to do with this application is really automate a lot of the workflow, which right now there is a lot of manual. And based on that, a lot of time being spent on the manual aspect of it. So being able to automate this workflow really gives the time back to our OPI specialists and OPI staff really to ensure that the applications are processed in a timely manner. And then another area is the data. And so with the data and the metrics that are going to be derived from the system, really giving the opportunity that there's going to be a lot more complex analysis on the back end gives our decision makers, whether it's a subject matter expert, whether it's leadership in the department, the ability to make those decisions fairly in a quick turnaround, rather than request the data and have some time before it's actually delivered. There's going to be dashboarding metrics and reports that are going to be available through this enterprise system. And at the end of the day, really, it's just being aligned to our educators, our stakeholders, and the department's strategic need, and being able to be scalable as you move forward, and being able to make the decisions and being able to implement any type of changes in the system in a lot easier process than we currently have right now in terms of the development time and effort that it takes.
Thank you, Zam. And I'll wrap up just another minute or two here, just letting you know how things are going in the licensure world here at the OPI. Our communication, so we are using our webpage. There's an FAQ listed with lots of questions that we are getting from the field, along with having our specialists on the phones to address individual questions. Our process, we are using, as Zam said, a paper application system right now. Renewals are coming in with no problem. We've received over 200 since the first of the year. And I can happily tell you that as of this morning, we are 100% caught up. Every single renewal has been issued that we have received as of effective today. So we're working hard. The misconception that the licensure unit is shut down during this time is so far from the truth. We are very busy. I can assure you that we are in MSIS getting everything cleaned up, applications finished, open applications closed, so that we have the data to transfer over to the new system. We will start training, as Zam said, in the new system. And with that said, once we have that training, we will be developing webinars and different tutorials on the new system for the public. Those will be on our webpage as well. So that will be coming in the near future. And, you know, truthfully, the biggest goal for us is to have this new user-friendly system, and all the work that we are putting in now and the patience of our public, and, you know, it'll be worth it in the end. So we appreciate that. And so lastly, the timeline for our Chapter 57 review. Last week, the Board of, well, this is the timeline that the Board of Public Ed adopted in their November meeting. And last week, Dr. Mergel and I presented Superintendent Artson's recommendations to the Board of Public Ed. Our Chief Legal Counsel, Jake Griffith, requested approval of the notice of public hearing pertaining to the amendment of our Title 10, Chapter 57 educator licensure, and authorized the filing of the notice with the Secretary of State for the publication in the Montana Administrative Register. So the board unanimously approved. The hearing date was set for February 24th, 2022, and all public input needs to be submitted by April 8th, 2022. The process now lives with the Board of Public Ed through the adoption of the revised rules that will be effective on May 27, 2022. So we are in good shape. It was a long meeting last week, but we got through it and went really well. And I am excited to see what the outcome will be. So with that said, I will turn it to any questions. I know our time's limited, and obviously this presentation will be included in my information as well if there's any outside questions.
Thank you, Crystal. Thank you, Zam, for that update. And we are coming up on the hour and want to turn a few minutes over to Dr. Mergel to update you on what is happening with the accreditation rules or school quality rules, as we're referring to those. Dr. Mergel, thanks for being here.
Thank you, Deputy Allen. Yes, I'm here today to just provide a very quick update on the Chapter 55 accreditation, revision, and review process. The OPI is working in partnership with the Region 17 Comprehensive Center to update ARM Chapter 55 on the 10-year revision cycle. After engaging in a research phase over the last year, there are two working groups that have been formed. The first one is the Chapter 55 Task Force, which we are calling the School Quality Task Force. And the second one is the Negotiated Rulemaking Committee. And we have formed the task force who started their work last Tuesday, a week ago today on the 11th. We launched that task force. We talked about the task force purpose, the process, the time, the deliverables, engaged in a preliminary discussion, and then kind of confirmed next steps. We will be launching the Negotiated Rulemaking Committee on February 24th, and we are currently finalizing that particular committee this week. We have a couple of more nominations that we need to make within that committee. But the purpose of the first group, the task force, is for them to make recommendations on the Chapter 55 revisions to the superintendent, and to also make those recommendations to the Negotiated Rulemaking Committee. So that task force is charged with making the initial recommendations to the superintendent and the Negotiated Rule Committee. It is within the Negotiated Rule Committee that they'll make those final recommendations to the superintendent and also prepare an economic impact statement. There are two key deliverables right now that we're focused on for the task force. That's to develop a field survey document that we will deploy in early February out to the field regarding all of the components of Chapter 55. And it is also to write a concept memorandum that can be passed to the negotiated rule committee. The memorandum contains current rule, proposed recommended redlined rule changes, and the conceptual changes and the rationale for that. We are meeting both in person and via Zoom in this task force, as well in the negotiated rule committee. We are looking forward to our in-person meeting to go deep into the work with our task force on January 25th and 26th. Just so that you know, we are communicating all of the work of this task force, as well as the negotiated rulemaking committee on our webpage. When you go to the main opi.gov webpage, you'll find at the very top right-hand corner the task force tab that will have the meeting minutes, the recording links, and agendas. You'll also be able to find out who the task force members are and some of that key information. We'll be keeping that updated there. The group will have its own Google site where they're keeping materials and group deliverables. All that's been developed and out to them so that they can work on that. During our sessions, we will be offering public comment at the end of each of them that will open up for attendees that are part of our groups to be able to offer any public comment kind of as we're going along, rather than just at the very end. So I would say, be checking out kind of our webpage as we're moving forward and kind of making that finalized. And then, like I said, we'll be getting information out at the end of this week to our negotiated rulemaking committee as we finalize those final few nominations. So that's just kind of the work and where we're at. So Deputy Allen, I stand for any questions that the group might have about this revision process or either task force, if you will.
Thank you, Dr. Mergel. We appreciate each and every one of you being with us today for nearly an hour and send positive wishes for a successful principals conference later this month over to Dr. Miller. I know his team's been working diligently on that effort. So good thoughts your direction. Again, thank you to each and every one of our presenters for being here with us. As always, we will be sending you out minutes of the meeting as well as links and documents that were shared with you today. So happy Tuesday. May the rest of your day be absolutely fabulous. Bye-bye, everybody.